Hello, everybody. I am Scott Wellach, Associate Program Director of the NICU Fellowship at Children's Wisconsin Medical College, Wisconsin. Today, I have with me Dr. Hang Nghiem-Rao, Associate Professor in Neonatology. Dr. Rao, thanks for joining us. How are you?
Good, Scott. How are you?
I am great, thank you. So, how long have you been at the Medical College of Wisconsin?
Approximately 9 years.
Okay. Yeah, I think you started just as I was graduating, so I got a little bit of your mentorship and as a colleague, which has been wonderful.
You're adding gray hairs. Gray hairs is what you're doing.
Look, I can't get any, so we're okay. So you have been quite successful in your research. Getting K Award the last couple of years. Would you mind telling us a little bit about what you do for research?
Sure. So yes, I have been fortunate to kind of establish my research here at MCW. I have a K-23 Career Development Award from the NIH. My research group investigates lipid metabolism and liver disease in critically ill neonates. And we do both clinical and translational research. What we do patient samples, and then we also use human-induced pluripotent stem cell-derived hepatocytes as a model system to investigate the impact of prematurity on lipid metabolism, parenteral nutrition-associated liver disease, and more recently, non-alcoholic fatty liver disease.
That is really, really cool stuff. The translational research, the patient stuff, and now I've taken on your first fellow this past year for mentoring. How has that been going?
It's been great. So I've mentored medical students on their research pathways. They have presented at national meetings and had publications. I mentored a former fellow who on a more clinical project, and also resulting in platform presentation and manuscript. And more recently, Svetlana, one of our new soon-to-be second years, is joining kind of like the translational part where we'll be using some work with the stem cell-derived hepatocytes.
Excellent. Yeah, I know she's been really, really happy working with you. I'm really excited. So, so we're doing these videos mostly because it's hard for the fellows who are fellow candidates who won't get a chance to meet all of us in person. So I wanted to pick your brain a little bit. Like, what are your thoughts of fellowship? Some of the strengths or reasons that candidates should apply and hopefully rank us highly when it comes to the fellowship process.
Yeah, I have to say, I think over the time that I've been here, the fellowship has evolved and grown a lot. It has grown in the number of deliveries, high acuity deliveries, and this is all in tandem with the growing maternal fetal medicine program, I think, at Froedtert and MCW. So their exposure to, very premature infants is there, as well as critically ill kind of congenital anomalies, cardiac disease. And because we're a major referral center, the surgical patients is huge too. And I think what's really good about our program, unlike some programs out there, we co-manage our surgical patients. There are programs out there who don't. The surgery patients just go to surgery and are maintained by them, but we have a very collaborative program with our surgeons. All of our subspecialists are just the nicest people ever. And it's just really nice to kind of work in that environment and train in that environment. I think I did not train in such a collegial environment, so it's something I don't think people should take for granted.
You seem to have gotten pretty used to the Midwestern feelings that I think all of us have grown up with that here. So excellent. Yeah. Now you've been living in Milwaukee for, you said, about 9 years. What do you like about Milwaukee? Why should a fellow candidate move here, at least for the city, not just a training program?
Well, I think, Milwaukee, the winters are, they take a little getting used to, but I think, I think that the environment in terms of the people, like you were just saying, the Midwest vibe, everybody is extremely nice here. And it's really a city that's manageable. You're not stuck in traffic for long periods of time, wasting away hours of your life. Everything is accessible. You know, you have culture, you have good restaurants. And if you really want to jazz it up, it's a short trip away from Chicago. So I think you get a city vibe, access to a very big city, but a very manageable, doable, livable city.
Excellent, excellent.
Okay. Yeah.
All right, so I don't want to take too much time. I know you have a lot of research stuff going on, but I'm asking everybody, just so that our candidates can get to know us a little bit better, tell me some interesting fun fact about yourself.
Oh, geez, I'm not that fun, but I do like to travel. We've gone to places like Greece recently, and France. And so, you know, COVID-19 put a little damper on that this year, but we're hoping that that picks up soon. We've done a lot of national parks over the years too. So not many people would think I'm a camping type of girl, but you know, I can do it.
I actually learned something. I was today years old and I learned you were a camping type of girl. So, all right, Dr. Nghiem-Rao, thank you so much for your time. For everybody, you can find more information on our website. You can look up all of Dr. Nghiem-Rao's publications. Thank you so much for your time, Hang. And if the fellow candidates have any questions, is it okay if they give you an email?
Absolutely. Or they can call, whatever is easiest.
All right, guys. Well, thank you so much. Have a good day. And everybody else, take care.
Bye.